All right, so this is Medical 2 training. I did provide training information regarding attendance and quiz requirements in your manual again, but I'm not going to go through that. I'm sure you guys have heard that enough. So please just make sure you're following through on that. I also repeated the information about HIPAA and the EHR data security just because it's so critical. So please just be aware every time you access PANDA about that, which we also talked about in Medical 1 in detail. So we are going to run through the SQL MU objectives first. This is page 6 of your manual. All MU objectives are noted in red font throughout your training manual, and the EPs must meet all 10 meaningful use objectives for 90 consecutive days, which must conclude prior to December 31st, 2016. So we are starting as of May 1st, our reporting. We're really hoping we can get those 90 consecutive days knocked out in those first 3 months to be able to just move forward. For 2017, we are required to report for 365 days. So things are going to be evolving as we move forward, and based on meaningful use, they just like to make it just a little bit more difficult on us every year. So please anticipate that. So this is definitely going to be a team effort. There is some admissions components with regards to the patient portal. Some sites are having admissions folks do that, which I think is great because it actually gets them involved in the MU objectives and can help us, be successful. And then the nursing and providers are just so critical to this whole initiative. So we really appreciate all your help with this, and just the importance of this. I just can't stress enough. So patient electronic access, we talked about this a little bit before, but this we're going to cover in detail towards the end of training. Basically, we need to provide access to more than 50% of patients to allow them to view, download, and transmit their health information. We talked about setting up the patient portal. That is really the number one thing we need to do, is set up patients with the patient portal. So this is going to be set up by the admissions and or nursing teams, depending on your site. I do feel like this is one we can achieve if we, at admission, get every client, legal guardian, or worker set up for the patient portal. Secure messaging is kind of related to the patient portal. We just have to have the capability for secure messaging, which PANDA does. So you guys don't need to worry about any of this. You don't have to use secure messaging for this objective. We just need to have it available. The public health reporting piece, this is really going to be Willett's responsibility. We're working with the state registries to meet this requirement. We have been in communication with IRIS and ACES for Woodward and Mingus, and we will be just doing some testing with them. So you guys really don't need to worry about this public health reporting at this time, but in 2017 there's going to be a shift there with regards to us submitting immunization data. Protected patient health information. We're required to have a security analysis that'll take place this summer. This again is Willett's responsibility, so you guys don't need to worry about this objective either. Clinical decision support. Implement 5 clinical decision supports related to 4 or more clinical quality measures. There are 6 currently enabled in PANDA, so this is going to help us meet this objective. So again, you guys don't have to worry about doing anything for this one. This one is going to be met just based on PANDA and how the system is set up. Health information exchange. This is one we're going to cover in detail more towards the end of training. So basically, when we have a referral to an outside provider, or we transition the care of a client at discharge to a provider, we need to create this summary of care record, which is basically just pushing a button in PANDA and send it electronically 10% of the time. We do understand that for a lot of discharges, we don't know who that receiving provider is going to be. So I think this is just going to apply for those situations where we do know who that receiving provider is going to be. With the referrals, like I said, we'll talk about this more, but I think with the referrals, if we know we have providers that we refer to a lot that are using certified EMR technology, they will have the capability to help us meet this objective. CPOE, there's 3 pieces to this. We need to make sure we are entering medication orders into PANDA 60% of the time, 30% of the time for lab orders and radiology orders. And we're going to get into both of those components today. Patient education resources, we did talk about this a little bit in Medical Training 1. Providers should provide patient education resources to 10% of patients during the medical visit. So this is going to be really a joint effort between providers and nurses. I have gotten a bunch of patient education resources from Mingus. Thank you for that. I'm going to get those entered into the system for you guys prior to go live so you can utilize those. But again, this is just 10% of the time. So hopefully we can we can definitely pull together and meet that objective. E-prescribing, 50% of prescriptions must be e-prescribed. The system will automatically do that drug formulary, so we don't need to worry about that, but we definitely need to be encouraging the providers to e-prescribe medications whenever possible. MedRec needs to be completed for more than 50% of transition of care patients. So the number one for this is going to be at the point of admission. I know you guys are doing MedRec currently, but there's going to be obviously a more electronic-based process in PANDA for this, and we are going to talk about that actually next. So please do note these thresholds are for 2016. The percentages will likely increase for 2017. As Marianne likes to say, we just never know what MU is going to throw at us. So just be preparing. I feel like if we can lay some really good groundwork on workflows for meaningful use now, it's just going to help us keep achieving these objectives as the years progress. All right, let's jump right into medication reconciliation. So as I mentioned, we need to do this for 50% of transitions of care in which the patient is transitioned into the care of our EPs or our providers at Sequel. So at a minimum, I did put this in detail in your manual, at a minimum, MedRec should be completed in PANDA every time a client is admitted to a Sequel program and every time a client is transferred between Sequel providers. So we did talk in the provider training a little bit about establishing care teams so that we won't have to worry about like if a doc's out and somebody's going to cover for them. So we'll be able to have that care team functionality. So this may be even more of a situation when they're transferring to a different site to a different Sequel provider. So, but this could include new admissions, readmissions, new docs taking on current cases, and current doctors switching patients or caseloads to a more permanent switch. So PANDA does have the ability to import a client's medications through this HL7 format that every EHR can produce, but based on my conversations with you guys, it sounds like a lot of times we get MedRec or medications in on a notebook piece of paper, a printed document, a post-it note. It sounds like they come in lots of different directions. So the process really is going to be that the nurse completing the admission is going to add the client's medication reconciliation list builder. The doctor will then go in, complete the MedRec prior to prescribing new medications and prior to the first patient visit. So MedRec actually lives in 2 locations in PANDA. It can be found in the medication reconciliation menu or by using the medication reconciliation section of the internal medical encounter. Let me get logged in here. So we can get into the MedRec. I will tell you that our proctor that is doing all of our EMR certification testing said that our medication reconciliation was one of the cleanest and easiest he had ever seen, which I was very happy to have him hear that because he's been doing this for about 5 years. So hopefully you guys find this process to be simple. I do understand if you have a client that comes in with 10 medications, this is going to take a little bit of time. So just be aware of that. Hopefully once you guys do this process a few times, you're going to see, you know, it's a little bit repetitive, but it's not really a complicated process. So when I log into the screen, you're going to see the clinical reconciliation. To actually perform the reconciliation on the left-hand side, the list builder is on the right-hand side. So to add a new medication, there's one medication already in here. I'm going to go ahead and hit this green plus sign. My reconciliation type, we're required for certification to be able to reconcile problems, medications, and medication allergies. For meaningful use, we're only required to focus on the medication, so no need to worry about the other 2 items. The source, we're just going to say Dr. Smith. This could be a separate academy. This could be juvenile detention center. It could be anything that would go in this source field. Medication, you're just going to type in a first few letters. And the system is going to search and find all of the medications that would fall in that category. So I'm just going to go ahead and select this. Once I select the medication, the strengths that are available will appear here. You'll notice that none of these fields are required. I do feel like it's best to put in additional information or as much information as we have. I think the date prescribed probably is a really critical one, so you can identify how long this patient's been on this medication. Patient directions. could also be put in there. So, but the rest of these fields are all optional. So enter as much information as you feel is appropriate for the doctor to make a, informed decision. So I'm going to go ahead and save this. Now that the medications are entered, the nursing piece is really done. So hopefully you guys are thinking that was a pretty straightforward process. You would just go through and you would continue to add medications, each medication to that screen, and then they're going to just appear here that are ready to be reconciled. I have detailed information in your manual about the actual reconciliation process, but I went through that in provider training, and I'm not going to walk through that because we have a lot of other things to cover. But basically, they would just push this reconcile medications button, and they would choose the medications that they want to pull into the PANDA system. All right. Next, I'm on page 13 of your manual. We're talking about e-prescribing. So let me get my e-prescribing patient here, Fred Jockey. So e-prescribing can be found under orders and e-prescribing. We did put it at the top because we feel like it's probably going to be the most utilized orders option in there. So I do have a screenshot in your manual of the different components. I try to make it super clear, corresponding numbers to the sections. So this section here is just patient details. It's providing like just basic demographic information on the client. If you want to see the patient header, it is also available up here. So if you need additional information, it is available. It's just hidden. Drug allergies are going to appear here. Fred Jockey has codeine as his only drug allergy. Coverage details. This information pulls from the SureScripts pharmacy database, which is who we've connected with to manage our e-prescribing system. So this is going to appear for about 80% of patients is what they tell me. This doesn't have anything to do with PANDA. It doesn't have to do with the medical insurance field in PANDA. It really has to come specifically from the pharmacy. The more you e-prescribe for a patient, the more likely these coverage details are going to appear also. So I got coverage details here. The patient's preferred pharmacy will appear here. And then the patient's active medications are going to be on the main area of the screen. I really do like the layout of this screen. I feel like it's really straightforward. So there are a couple medication features I want to let you guys know about. The drug-drug interaction checks and drug allergy interaction checks. This is one of the reasons we have to put our drug allergies into this screen so that these drug allergy checks can be done appropriately. I did provide screenshots of all the alerts in your manual. Please notice that the minor alerts are in small font, and the more major the alert gets, the larger the font. So they really are trying to draw your attention to it. If you click on the blue hyperlink within the alert, it will tell you more about why there's an interaction there. You can still proceed and order the medication. It will not stop you from moving forward with that process. Also in your manual, I have information about the drug formulary. I'm not going to walk through that because there's certain medications that I have to order to trigger this, and I don't want to waste time doing that. But with drug formulary, it's always going to appear in the add new prescription screen when you're entering in the patient instruction, patient details, refills, and so on and so forth. There's 3 different formula statuses in PANDA. There is the full formulary. Basically means the medication is covered by the client's insurance. It provides details on out-of-pocket costs, copays, so on and so forth. The second one is the formulary unknown. Basically just says that there's no information provided for that medication via that medical insurance. So you will come across that sometimes. And then the non-formulary basically is saying that this is not covered by the patient's insurance, and it gives you some therapeutic alternatives to choose from that would be covered by the patient's insurance. All right, let's talk about the adding a drug medication allergy to the system. So I do feel like this is really straightforward and easy to do. We do recommend that you guys get the drug allergies and the non-drug allergies entered into the system prior to go live. I think it's going to make things easier when you guys do go live, so highly recommend we do that as the nursing teams. I'm on page 11 of your manual, adding and editing patient's drug allergies. So as I said, this section here, drug allergies, all I need to do is click on this orange hyperlink. If I have no known allergies, I would select this checkbox here. I'm just going to go ahead and add one more drug allergy for Fred. I'm just going to pick one. I would enter in the allergy reaction. You'll also notice we have active or inactive, allergy or adverse reaction, and then the onset date. There has been a lot of talk about, we don't always know the onset date of an allergy. We can edit that in the PANDA screen in the non-medication allergies section, but we are not able to edit that in this screen. So we really just have to do the best we can to pick a date. I know that's not ideal, but we are working with an e-prescribing vendor, and these screens, they belong to them. So we interface with them to be able to use that. So we cannot make changes to this. I just want to make sure that that's clear to everybody. So I would just hit add, and then if I needed to add another one, I'd just go through that same process. Patient's preferred pharmacy, also recommend that you guys add this. I know you guys use pretty much the same pharmacy for all your clients on site. I wish there was a way we could add all the pharmacies to all Mingus patients with one swoop, but there's not. I asked. Do recommend that you guys put the preferred pharmacy in here prior to the docs getting in there and e-prescribing. Otherwise, they will be stopped at the e-prescribing process saying, hey, you still need to add a pharmacy. So please be aware of that. I'm going to go ahead and add a new pharmacy here. The search field, there's a lot of fields here, but you really only need to enter in part of the name, and I recommend that you enter in the state. If you're going to use a Walmart, and this may not even apply to the two programs that are going live first, but if you're using a big Walmart or a Walgreens and there's a bunch of them in a town or a state, you definitely want to make sure that you're putting in a little bit more information so you don't get a huge list to choose from. So I put in the name, state, click search, and then I would just select the pharmacy that I want. Let's say that I decided I don't want the Fletcher Allen one in here. I'm just going to click on it and it will remove it. So as soon as it turns pink, if you click on it, it will remove it from the patient's preferred pharmacy. So luckily that only has to be done one time. And like I said, since you guys use a lot of the same pharmacies, hopefully that process won't be complex. From this screen, if you want to get back to the main patient details, you're going to click on the Go Back to Patient Details link that's here. If you wanted to add a new script, you could go ahead and do that here. All right, medication history. So medication history will appear if the coverage details are available. If this section says no information or nothing available, you will not be able to pull the patient's medication history. So for the patient medication history, this patient has given consent to retrieve medication history. I know Marianne is working to identify if we need to add this to some of our consents at admission to make sure that we are not violating anything. So she's following up on that for us. So I would just check this box and click on Show Medication History. It's going to show me basically every medication that's been prescribed through this insurance for the last 2 years. Please do note, though, they did say that there is a chance there's some medications that may not appear on this list. If there's like medications that are super sensitive that the patient has asked not be disclosed, or even medications that were paid for in cash, they will not appear here. All right, CPOE. So this is the components for the e-prescribing screen with regards to meaningful use. So I'm on page 22. CPOE includes medications, lab, and radiology orders. Obviously in this screen we're just talking about medications. I did put some reasons why we want to pursue this. Obviously there's some patient safety stuff. There's a study that I had found that physicians made 7 times fewer med errors when using the electronic system. And there really is less risk by using the electronic system. So for MU, we have to enter 60% of medication orders into PANDA. I really feel like we can really be close to 100 with this, just because if we are passing the medication, it has to go through the e-prescribing screen. Even outside medications, anything that's going to show on the MAR has to be entered in through here. So I think that we can get closer to 100% on the actual entry of the medications. E-prescribing is a component of this. 50% of the time we need to e-prescribe. I know you guys have all heard me say it. Please try to e-prescribe as much as you can. You can send prescriptions to any pharmacy pretty much in the entire country. So please be pushing the providers to do that and encouraging them. All right, so I do want to be very clear with this next point because I know this is a change in workflow. I know currently some of you guys do phone orders or verbal orders. So with regards to the e-prescribing screen and the functionality within PANDA, nurses are able to enter medications into the system, but they cannot approve them. So you can, when we talk about the entry, you guys can do 95% of it. But that 5%, that last part where they're entering the PIN number and hitting approve and send, has to be done by the doc when they're logged in as themselves. That sends the DEA number to the pharmacy with a prescription, which is obviously important. So I know that is a change. You know, it's going to be a big adjustment for the docs to make this change, hoping that since, you know, PANDA is available on their phone, on a tablet, that it's not going to become an issue, that they're going to be able to get in and just hit that button to approve and send. But I do know this is a big change for you guys. So patient-reported medications. There is two ways to enter patient-reported medications into PANDA. The add patient-reported, you'll see both of the buttons are here. Add patient-reported, this is just going to allow you to add the medication. There's no details, there's no dispense instructions, there's no patient instructions. It's just adding this medication to the patient's active medication list. So I would just hit save and it's going to appear here, but you can see there's just no details. It's just the med. I don't anticipate you guys using that a lot. The detailed reported medication, which button is right here, this is the way we're going to enter medications into PANDA prior to go live. The benefit of this is that we don't have to have the doctors involved, but there are the fields available to be more detailed with the medication. So let me just go ahead and enter in medication here. I'm just going to pick my dose. If you don't have a specific dose or it's not appearing here for any reason, just select unspecified. The rest of the fields on this screen are not required. I do recommend that you enter as much information as you have, but they are not required. Take one every morning. And I'm not going to worry about the dispense because we're not actually sending it to the pharmacy, and I'm not going to worry about the refills either. So I'm going to go ahead and save that medication. So you're going to see they're similar here, and these are showing as patient-reported medications, but there are a lot of differences. You can edit this medication. The doc can come in and just click order. So pull that medication available to be ordered. Just all they have to do is enter their PIN and hit approve and send. So the detailed medication functionality definitely has an advantage over the add patient reported. And again, as I said, we'll use this process to enter in all medications prior to go live. So I did get a question from Woodward yesterday. So when you guys first log in, you get kind of a notification that says you are a proxy user. Who are you entering information into the system on behalf of? Those weren't the exact words, but it was something along those lines. So the question from Woodward was, you know, we have medications from outside providers because they don't have like a specific medical provider on staff. So I talked to DoseBot about that. They said that when you're entering patient-reported medications or detailed reported medications, nothing in that provider section is going to link to the order. It only links to the order when you go in for an actual prescription. So Woodward, you guys can select either Kirshna or Sue and enter in these detailed reported medications. It does not link them to the doctor in any way, shape, or form. The purpose of that screen that you guys get is when you enter this prescription, that provider is going to see it as a pending prescription up here. So if you select Dr. Murthy when you're entering in the e-prescribing screen, Dr. Murthy is going to see this pending prescription. That's really the purpose of that initial screen. If you guys have questions about that, please let me know at the end or jot it down and we can definitely cover that in more detail if needed. All right, so the next activity should be followed anytime a new prescription is entered into PANDA. As I said, nurses, you guys can enter the majority of it, but the doc has to sign off. Let's just walk through one of these. I'm going to add a new prescription. I've created quite a favorites list. I'm going to show you guys how to do that through this process also. Let me see. I'm going to select Zoloft. I'm going to select the dose, and there's not been a situation where a certain dose wasn't available. If it's at the pharmacy, SureScripts knows about it and they provide those doses only. So you shouldn't ever run into a situation where your dose is not available. Take 1 tablet. My typing is not the greatest today. We're going to dispense 30 tablets and we're going to say we got 2 refills. So you'll notice that there's an option for no substitutions if you don't want them to use any form of generic. If you want to enter pharmacy notes, you can click on this Show Pharmacy Notes. You put specific notes in here to the pharmacy. Day supply, this is not required unless you're using a controlled substance prescription. Then you will have a day supply required. You will also see in here up at the top will be the date that it's being prescribed. Both of those fields will be required for controlled substances. I know I'm covering this later in the training with regards to creating a favorites list, but I'm just going to do it now because it works perfectly in the timing in the screen. So if I want to create this medication as a favorite because the doc uses it a lot, I'm going to go ahead and click on this star. The star is going to turn orange, so I know that I've selected to save that as a favorite. Now once I hit the Save the Prescription, it's going to pop up as what do I want to save this favorites as. So I'm just going to say Zoloft. If you want, you can be more detailed. You could say Zoloft in parentheses Dr. Murthy or 25 milligram or whatever details you want to save that to create your favorites list. I'm going to go ahead and hit OK. It's going to save that medication. Now this medication is ready for the provider. So at this point, if you leave this medication, leave this screen, that doc is going to see it as a pending prescription that is going to appear here for them. So they would just need to come in, enter their PIN number. Well, first select the medication they want to send to the pharmacy, enter the PIN, and hit Approve and Send. And you can see since we entered the pharmacy information will appear here, so they won't have to worry about that. So I'm just going to go ahead and send that. So when they initially send it, you're going to see this status, which is this dark gray arrow. This is on the way to the pharmacy status. I'm probably going to get a transmission error because obviously I'm in the sandbox and it's not connected to a pharmacy. But when it successfully goes to the pharmacy, you're going to see a green checkbox appear here. That means it has reached the pharmacy, it's successful. I did mention in the provider training there are possibilities of transmission errors, but they said it was less than 1% of the time. So I don't anticipate we're going to run into a lot of issues with that. A lot of times it had to do with pharmacy information being incorrect, and I think you guys are at an advantage since you guys use the same pharmacy for all of your prescriptions. If I want to add another new prescription, I want to show you this. This is my favorites list I've created. Here's the one that I just added, Zoloft. If I want to just use this medication, I click on it. All of the details are already here. So I don't have to enter in anything else. All I have to do is click Save that prescription. And then it's ready for the doc to sign off on it. So I think for you guys, since I know, oh awesome, it is telling me it went to the pharmacy. So I think for you guys, I think it's going to be super beneficial to create those favorites lists since I know you guys will be doing a lot of the entry of medications into the system. Okay, the remove and reorder functionality, I'm going to talk about that just quickly. If I want to reorder this medication, all I need to do is click on this reorder button. It's going to be ready to go to the pharmacy then. The doc, all they need to do is put their PIN in and hit Approve and Send. If you get a medication here that you don't want here, all you got to do is hit that delete and it will remove it for you. So let's say that this patient is no longer on amoxicillin and I want to remove that amoxicillin from the active medication list. I would just click Remove. It's going to give you 3 choices. The first 2 are going to give you a text box and you need to complete some sort of note. See, we could just say completed therapy. Discontinued will also give you a text box. Duplicate mistake does not give you a text box. I kind of wish that it did, but it doesn't. Please be aware if you're using a duplicate mistake, it will remove that medication completely from the patient's chart. These top 2 are going to move the medication from the active med list to the inactive med list, which is what I think we would use 99% of the time. Obviously, if for some reason we got a medication entered in the wrong patient's chart, I know that that does happen. I've had experiences with nurses and doctors where that's happened. That is when you would use that duplicate or mistake functionality, but that really should be the only time. So you'll notice that I have my medication here. It's moved from the active list to the inactive list. If I want to reactivate that medication and move it back to the active list, I would just hit that activate button. If I want to reorder it, it will take me through the order screen. So hopefully these links are going to be super helpful. I know, there's a lot of medication changes that happen frequently, but if you have a patient that's on a medication for an extended period of time, being able to just come in here and reorder the medication, not have to enter in any details, I think is going to save a lot of time. All right, I talked about creating a med favorites list. I think I've covered everything I need to cover in e-prescribing. Let's start talking about the EMAR. So I'm on page 37 in your manual. So learning objectives for this section, we're going to talk about creating a dispense schedule. We're going to talk about entering PRN medications into PANDA, and we're also going to generate a MAR. And you can do that for a dorm, or you can do that for just a specific client. I'm going to change over to Ping. So you're going to find this under Health, EMAR. So I recommend that you start with the medication dispense times, or the PRNs, obviously. You need to get those entered in before you generate the MAR. A medication that is entered into e-prescribing and is on the active med list will appear under the medication dispense times menu. So let's start there. If it has not been entered into PANDA, it will not appear here. It will not be available to add to the MAR. So please be aware of that. So we will plan on continue to use a printed MAR. We try to make this MAR very similar to the one you guys have been using. The layout is a little bit different. We put all the patient information at the top versus on the side. But we are in the process of developing an electronic MAR, and we do anticipate it's going to be completed in 2016. I know some of our sites are going to be happy about that. I know some of our sites are going to say, oh my goodness, what are we going to do now? So I know there's going to be some changes in workflow that will occur, and we'll have to talk about that more when we get ready to launch that EMAR. So the medication dispense times. This, we've talked to a lot of the MU sites about the MAR, how we want it to work. We basically have set up a way for you guys to be in complete control of every single client's MAR. You get to basically build it from the ground up. When are they getting the meds? Has the consent been approved? Does the client need to sign off and initial the MAR? Some sites do that, some sites don't. So through this process, we've basically given you guys complete control, which I think is awesome. So you can see right now I have one Ativan medication that's going to appear on the MAR. It does require a client signature, so all that means is it's adding a box to the MAR for the patient to initial. Guardian consent, yes, we have received the guardian consent for the Ativan, and I have a start date documented and the times it's going to be administered. If I want to edit this, I would just hit this edit button, but I'm going to go ahead and add a new medication dispense time. So I'm going to hit that green plus sign. So this drop down, as I said, these medications have been entered in for Ping in the e-prescribing screen. So that is why these are available here. Let's set up a dispense schedule for trazodone. Dispense time, let's say he's just taking this in the evening. So you do have a 24-hour clock here. You know what, I shouldn't say that because now I see I'm missing the early morning, wee hours of the morning, so I have to get those added. At the bottom you'll find the PRN. So let's say he's taking this at 8 o'clock. Do we need the client signature? Yes, we want to have that box for them to be able to sign. Has guardian consent been approved? If you select no, you can still add the medications to this system, which I think is helpful because at least you know it's in there, but the guardian consent hasn't been approved. If I select no, it will not appear on the MAR. It will just appear on that medication dispense time screen. Start date, we'll just say he's going to start this today. And if there's an end date, you would want to put that in here. The end date and the start date will appear on the printed MAR. Reason for the medication, I'm just going to put sleep in here. So you can see which fields are required. There are additional fields if you guys want to add additional information. You can just complete that and hit save. So now when I pull up Ping's MAR, you're going to see the Ativan and the trazodone both available on his MAR. Let's talk about PRNs. Okay, so there has been a lot of discussion about PRNs in compliance meetings, about standing orders, quote unquote, over-the-counter meds. It's just been a lot of conversation going on about this. So initially, when we started requesting the standing orders documents from you guys, I thought it was an order. Like I thought for CPOE, for medications, we had to enter it, we had to track it, but we were wrong. I was wrong. We talked to Sonia Shireling, who is just by far the expert on compliance or anything along with that. So she basically said that the standing orders form signed by the client's guardian is actually a PRN consent form. We do not require an order. SQL does not require an order to administer a PRN or over-the-counter item. So that was totally news to me. So please be aware of that. I know we still have that standing orders mindset, but it's not necessarily an order and it does not need to be approved by the doctor. So PRN medications must appear on the MAR if they're administered to the client. This has also been a hot topic of conversation. I know, Mingus, you guys
Katie?
use, yes.
Can I add one line to your statement about the orders?
I would love for you to add a line.
Okay. So while we say, sorry, I have a cold, guys. So while we say that you do not need a doctor order to provide PRN OTC medications, you are still more than welcome and encouraged to have the doctor review and sign maybe the consent form that the guardian is reviewing, and basically like approve that the client can take all of those meds. You know, we don't want a kid on an OTC blood thinner if they're already on a prescription, but it is not an actual doctor order. So we will be working to reword policies and stuff to say doctor approval, doctor directive, but not order, because once it becomes an order, every single over-the-counter medication that the client could possibly receive, so if you have 100 of them, all 100 have to go into e-prescribing, which is a nasty process. So by finding this loophole, we can help you guys out of having to do all of that and meet that standard.
Awesome. Good info. So I know some of the sites have a supplemental PRN medication log. You guys can still use those, but to pass a medication, it has to appear on the MAR. So I know we'll have to be working with you guys to figure out the workflow for this or the best approach for this. Woodward, it does sound like you guys are currently in Willits entering every single medication on the MAR, so that's not going to be a change for you guys. But I know that there is conversation about this and that, you know, there's some things we still need to work out. All right, so let's talk about PRNs. Let me get over there, excuse me. So you can add PRNs two ways. You can add a single PRN or you can add a bulk PRN. So I'm going to go ahead and add a single PRN first. We'll just walk through this process quickly. I'm going to hit this green plus sign. I'm going to select my PRN. So I know you guys are going to see a lot of PRNs in here. These are all PRNs for all residential sites for meaningful use. I have asked Jason if in the future we can have this based on site so that Woodward would only see Woodward's PRNs. Mingus would only see Mingus's. He said that is a possibility and that shouldn't be too complex and that we can do that. I can tell you that's not going to be done before go live. So I just want to be aware. I know you're seeing 7 different forms of acetaminophen. We're not trying to cause confusion. A lot of these are really more detailed for Bernalillo because they just had a bunch of different requirements. So just be aware of that. I'm just going to go ahead and add Benadryl. I want to pick my dispense times. I'm going to scroll to the bottom and pick PRN. I do want to have the client's signature box on there. I'm not going to worry about the start date and end date since it is just a PRN medication. And hit save. I think one thing to note too with the PRNs is like Bernalillo has a PRN for sunscreen, which I didn't even know was a PRN. So we definitely do not want to have to add sunscreen through our ordering e-prescribing area either. All right, so the single PRN, that's pretty straightforward. It's very similar to the dispense medication screen. So we do understand that you guys have lots of PRNs. So we've created the bulk PRN possibility. So if I click on this little menu over here in the right-hand corner next to the green plus sign, you're going to see Add Bulk PRNs. I'm hoping you guys think this functionality is as cool as I do because I was really impressed when Jason came up with this. So I'm going to go ahead and select the medications that I want to add to the PRN for this client. As I said, there are quite a few in here. And we'll do that one too. And then I'm going to say add selected to the EMR. So now you can see I've added all those medications to the main screen. I will tell you right now this signature required is defaulting to no for the bulk PRNs, but that will be defaulting to yes prior to go live. I just caught that recently. You'll notice all the times are going to be PRN. That's going to be the default. If I need to add an additional time for this, if this patient, maybe this is using it a couple times a day or something, I would just go to edit and I would add another dispense time for this PRN. All right, now that I've gotten my prescription medications and my PRN medications added, I'm going to go back to my EMR and I'm going to generate. If you want, you can generate your MAR by dorm, or you can generate it just for Pink Panda, and that's on the right-hand side. If I want to do it for next month, it's also available here. So I'm going to go ahead and generate my EMR. You're going to get a pop-up in the bottom of the screen. The pop-up may vary based on if you're using IE or if you're using Chrome. I'm going to go ahead and click on my MAR and we'll take a look at it. I did put a screenshot in your training manual of Rey Skywalker, who is one of the Star Wars characters, I guess. Her MAR. I can tell you right now that there's something off with this first page, so we're getting that corrected. I've also asked Jason if there's a way we can get more medications on this page, whether making the picture smaller, the code smaller, I don't know. That's just to find a way that we can get more medications printed on each page, especially if we are asking you guys to add all your PRNs. Otherwise, it's just going to be a lot of paper. I will note also, I did tell the DONs at both Woodward and Mingus that if you guys want to print your MAR for May from Willits, that is fine. That is totally fine. We do expect you after May 1st to start using the PANDA system, but I know you guys usually print your MAR for May 1st, probably on April 30th. So just be aware that you guys can totally do that for this next month. It's not a big deal. So you'll see the picture at the top. You'll see some basic patient demographic information, DOB, what dorm they're on, any diagnoses that are in the system. Allergies are going to appear here. I forgot that I made Panda allergic to chocolate, poor guy. I'm going to see my medications listed here. I'm going to see my start date, the reason they're taking this medication, and then I got my PRNs that are going to load beyond that. So this nurse initials, let me talk about that for a second. So there has been some conversation about that. I know currently Mingus has it where all the nurses print out on their MAR. Woodward, you guys said that you use a paper process because your direct care staff do the medication administration on the dorms for you guys. The plan is that we are going to have functionality in the system, and as an administrator, I will go in and I will add all nursing staff to this section here. We will be responsible for managing that. So if you guys have new nurses, you would just let me know, hey, I need a new nurse added to my form. For Woodward, we can definitely just leave this blank for now since you guys are using a different process. If you guys decide you want to use this process, you sure can. But I know you guys, since you said, you have med pastors kind of come and go and it's hard to keep track of, turnover with staff and all that, that may not be the best approach, and then we'll just print as it appears here where there's just nobody listed. This code section, each program that we talked to had a different process with codes, and we had to make it streamlined. It had to be one process because we just can't spend time creating all these different codes for the different programs. We decided to go with the number approach. So if there's an error, you would just document a number 1, refused, number 2, and so on and so forth. If you guys are finding that there is a code that you guys use that's missing or something that needs to be added, please just let me know that. All right, let me close my MAR. If you guys got questions, you can always ask them at the end or reach out to me after training. Okay, so let's talk about lab and radiology orders. So I'm going to go to orders, and then I'm going to go to lab and radiology orders. I'm going to switch my client because I got Pepper Smith set up for labs. Okay, so throughout your training manual, you may see some screenshots. I think I caught most of them, but I may not have caught all of them. You may see some screenshots that say lab and diagnostic orders. I still haven't had them change this. I had them change that initial menu, but I still haven't had them change this. So this was clearly my fault, but there was some confusion about what was required for CPOE. Thankfully, I reached out to Sam, and Sam was like, you know, an EKG definitely could be a diagnostic order. So I started thinking, okay, I know EKGs are not covered by CPOE. So basically, when it comes to all lab orders and all radiology orders, they have to be entered through this screen. To meet our CPOE requirements, which are noted in your manual, 30% for lab orders, 30% for radiology orders, we have to use this functionality. If we don't get any credit for them. So please just be aware of that. EKGs, other diagnostic tests do not have to be entered through here, and they can be entered through the procedure screen. So this is just for labs, radiology. Hope everybody's clear on that. So I have a little bit lab overview in there. I'm not going to get into too much details. We're working with a lab vendor named MDON. They have an in-network, a large network of labs, which includes the LabCorps and the Quests, and just like some of the bigger labs in the country. And then we have out-of-network labs, which are the smaller, small town kind of, maybe singular labs that are not in the MDON network. So I know you guys know this. We've reached out to all the labs, and we're trying to get connections with them. Getting them to join the MDON network would be super beneficial for them because then they can receive and send results back electronically and don't have to worry about this paper process. So we're really hoping everybody jumps on board with that, but it's up to the lab to decide. So while we're making these connections, we have set every lab up with a standard lab to use. The standard lab will allow us to meet the CPOE requirements and will allow us to enter lab and radiology orders into PANDA, and it will allow us to print a requisition and a specimen label. One note, and I'm not using Internet Explorer right now because I'm not planning on printing anything, but if you are going to print a requisition or you're going to print a lab label, you must use Internet Explorer to access PANDA. I know majority of you really do use Internet Explorer that I've talked to, so it shouldn't be an issue, but please be aware of that. The printing functionality just does not work well in Chrome. Or Firefox for that matter. You can print the requisition, but the format is not as clean, which I can show you, but the specimen label will not print from Chrome. So just be aware of that. Everything else in Panda you can do from any of the browsers, but within the lab piece for printing you cannot. So the lab screen, as you guys are seeing, is very different than the Panda layout. Ideally, we would have been able to create our own lab system, but that was just not in any sort of project scope or feasibility at all. Connecting with MDON does allow us to connect with those large labs, which are used by a lot of SQL sites, so I think that's going to be very beneficial. But the format is different with the layout. So you'll see that there's tabs across the top. Patient, this is going to provide any patient information. This is pulling directly from Panda. You'll see patient demographics. On the bottom, you're going to see the insurance information, and this also is pulling from Panda. There should be no reason for any sort of data entry or editing from this section. Orders tab. You guys are probably definitely going to be using this tab the most. From this tab, you can create new orders. You can view all orders that have been entered on a patient. You can check the status of an order. You'll see partially reported, so I'm doing some testing with Quest so that we can get connected with them for Bernalillo and the SQL Care Florida sites. So we're working on some testing. Most of the time, if you're connected to a lab, you're going to see transmitted. If you are using the standard lab order, you're always going to see entered, which means that it was entered into the system, but it wasn't sent electronically anywhere. All right.
This section too, just to reiterate, is for lab and diagnostic orders. So restraint orders, admission orders, ratio orders, no other orders will go in this section. No med orders, just the lab and diagnostic orders.
Perfect. And it's radiology, Marion. Sorry.
I was going to say that, but it still says diagnostic, so I just went along with it.
Oh, no worries. I'm just giving you a hard time. Okay, so I do highly recommend that you guys send at least 1 or 2 of your medical staff to the labs and orders training that I think is occurring tomorrow. I can't keep track of the training schedule, but if you guys have a question or don't have the training schedule, please let us know. But it's just basically set up to be an hour-long training. I'm only going to focus on lab and radiology orders. There will be some things covered in that training that are not going to be covered in this training. I did include all of the items that I could identify and put them in your training manual, but I'm not going to cover all of them through this 2-hour training. It's just impossible. So I do highly recommend that you guys send at least 1 or 2 people. If you have somebody that's really does a lot of lab ordering at your site, have them come to that training. It's just 1 hour. All right. So I'm going to tell you up front that this next section is going to seem long. It may even seem a little confusing. My plan is I'm going to run through this process in detail following the training manual, but then I'm going to walk through the process kind of without instruction and show you really how easy it is to create a lab order. There is a lot of information on some of the screens that you're going to think, oh my gosh, there's too much information. You don't really need to edit any of that information. We're going to get into that. So this instruction is for the standard lab. As of this moment, both Mingus and Woodward are going to go live with the standard lab on May 1st. LabCorp is supposed to be in process of working on our interface, but as of this moment, we are not connected with them. So this is going to be about the standard lab. Once Mingus connects to LabCorp, I will create specific training documentation for that, because there are just a few little nuances when you connect to the lab. So first I'm just going to hit create order. It's going to bring me to this screen. This screen, I know, it has a lot of information on it. You don't need to worry about 99% of it. You guys are always going to have a standard order. There are other order types here. Recurring order, which we will talk about in labs and radiology training. A recurring order is a standing lab order, just so you guys are understanding that. PSC would be a patient service center type of order, so this is going to be more of an outpatient functionality. So you guys will always default to standard order, which means that the specimen is collected on site and sent to the lab. So no need to worry about that field. I just want to make you aware of it. Bill type, you guys will always default to third party, because that basically means that the lab is going to bill the insurance first, and then it will send the information to the guarantor any outstanding costs. But these two are both going to default. You'll never have to change them unless you're going to do a standing or recurring order. This information is all pulling from PANDA. This information is all pulling from PANDA. So none of these need to be edited or changed in any way. The only section that matters on this screen for you guys is the order information section that's right here smack in the middle. I want to make sure I'm selecting the correct lab. I'm going to do a standard lab order. These are test labs that are in here. I will ask, please do not use the Quest Diagnostics Dallas lab. We are doing testing with them. If you send stuff, it actually goes to them. We do not want to send anything to them. We are trying to complete our interface. So please do not use that lab. I've asked them to remove it, but they can't remove it until we're done with all of our testing. So standard lab order, that's where we're going to start. So we select our lab. We select our ordering physician. If you only have one ordering physician, it will always default to that physician, but you guys have multiple docs, so you're going to see your 2 docs or 3 docs or 5 docs in that list to choose from. The operator, I'm set up as the admin. This will be the list of clinicians that are set up in the lab system. So when you guys have new nurses come in, and we have changes in that, you guys need to make sure you're communicating that to me as soon as possible. The information I need is the first name, last name, and date of birth. That's it. So if you have a new nurse, you need to send me that information. I have to set them up in the lab system, and I have to set them up in the e-prescribing system so that they can access those components. So please just be aware of that. Your facility will say Woodward Academy or Mingus Mountain Academy. You'll never have to change that. Collection date and time will default to right now. If you collected this an hour ago and you're just entering it in now, then you want to make sure you're saying it was an hour ago. You can just change this field. There is a little calendar here. It's kind of sneaky, but if you need to change the date, you just do that. All right, so as I said, you only need to double check the lab and double check the ordering physician. That's it on all this screen. So now I want to hit next. There's going to be a next button at the bottom, and there's going to be a next button at the top. They both take you to the same place. They put it in 2 locations to try to make it easier. So now I'm on the actual order entry screen. So for the orders, let me get down to my training manual to make sure I don't miss anything. For the orders, you want to make sure, well, first off, we're really hoping that you guys can just use your preference lists that have been created. I created preference lists for both Mingus and Woodward, and you would just have to select this item here. I would just select the CBC. If you cannot use that, if you're not finding what you need here, use these little binoculars for the test code search. And I did put some information on the different test code search options. Oh, come on and load up, buddy. Well, it's going to take its time for some reason. So there are options with the test code search. You can select just a keyword, or you can select a keyword with the asterisk surrounding it. So that basically means that it will...
Hey, Katie?
Yes?
Will you back up and go over the last few sentences? Because we couldn't hear you on our end. You were blacked out.
Okay. As I mentioned, hopefully you guys are going to be able to pick... I see Sam, we lost you. Are we back? I hope you guys can hear me now. It said audio connection restored.
Yeah, I can hear you now.
Okay, perfect. So you would either select from your preference list, which are in process, or you would click on that little binoculars that's here to open your test code search. So in the test code search, you can enter a keyword, or you can enter the asterisk surrounding a keyword. So the difference is, and I put examples, we'll say, let's just use the lipid example. So if I just type in lipid, I am only going to see items that start with the word lipid. If I surround that with asterisks and I search, it's giving me one additional one, but it's going to pull anything that has the word lipid in it, whether it's the starting or the last word or the middle word. I do want to know, I know you guys are seeing that pop up. When you're kind of technically not leaving PANDA, but you're kind of leaving PANDA when you are using the lab and e-prescribing screen. So you may get that pop up saying, hey, you might time out. So just be aware of that. Just click that green, stay logged in, and keep on rolling. But you guys may see that more frequently when you're in these sections sometimes. All right, so I'm just going to go ahead and select my lipid. Hopefully that makes sense with the asterisks. It just broadens your search, basically. If I want to add this item, and you guys do have the capability of doing this, but if you add an item to your preference list, it adds it for everybody at Woodward or everybody at Mingus. So please be aware of that. If I want to add this to my preference list, I would just select the item that I want. So I'm going to use this item in this order, and I'm going to save it to my preference list. So here it is, the test that I've chosen. I do want to make a note for these miscellaneous tests so you guys have understanding of this. So the miscellaneous tests will be utilized if you cannot find the lab you need. With regards to the standard lab, they've entered in the most common labs ordered at the large labs. That means that not every single lab is available. So if you run into a situation where you're like, man, I just cannot find this. I've looked by keyword, I've looked with asterisks, I've tried everything I can. If you cannot find that, use the miscellaneous test. You can use miscellaneous test 2 or miscellaneous test 1. I'm going to just put one of these on your preference list. So it will be available and visible. You don't have to search for it, but you will use that if you cannot find your lab. If you're ordering a radiology test and you're not ordering any labs, you're always going to use the miscellaneous radiology test that is on your preference list. And I'm going to talk about that a little bit more in the next section. But there is not radiology codes in the system because we're not connecting to any radiology sites. We're not connecting to any outpatient imaging sites because we just don't do that enough. So when we're ordering radiology tests, if we need to place that order, you're always going to use the miscellaneous radiology test order. So for this, I'm just going to get my lipid panel. You'll notice that when I selected my lab, the ICD-10 code preference list appeared. So hopefully you can just select it off your code list, or you can search by a few letters of the code. Marianne gave me this suggestion because it seemed like this is used quite frequently. F31 is going to give you every F31 option that's available. You can just select one of those. If I want again, I can save it to my preference list if it's something I use a lot. And with this functionality, you can also use this binoculars and do a keyword search. So let me see if I wanted to do bipolar. it's going to give me every item that has bipolar at the start. It's the same thing with the asterisks. If I put the asterisks, it's going to give me anything with bipolar in the entire name. Hopefully that's fairly clear. Really, over time, when you guys get used to using this, it does sound like you guys use a lot of the similar codes. Add to your own preference list, and you'll be able to just check through and check the boxes that you guys need. So I have a lipid panel. I'm connecting it with this bipolar disorder current episode ICD-10 code, and I'm just going to click Add to Order. There's some fields here at the bottom if you want instructions or comments. If you want to fax results to a different number beyond what you guys usually do, you can enter in information there. Go ahead and hit Validate the order. For the standard lab, you're always going to see this next screen. You will not always see this next screen if you're connected to a lab. This allows you to enter the test code, but you do not have to enter the test code. It's just an optional field. If you want to clarify with the lab, like, hey, I want to use code 47.2, then you would put that in here. Not required, though. So I'm going to save the order. And the next screen, you're going to see your requisition. So I put in your manual a screenshot of the label printer. I don't have a label printer installed on here, so it would appear up here in that little screenshot that actually has a little highlight line through it in yellow. It's going to appear up here, and your label printer will default into that field. We had them set all the label printers up with label in the name, so that allows it to default. If I need to print 3 specimen labels, I would just change this number to 3. Please note that the specimen label information is not test specific, so if you need more than 1 specimen label, just change that number. You can use it for multiple tests. It basically contains patient demographic information only. So now that I'm at this step, my process is not complete yet until I hit print and send. When I hit print and send, so I'm going to get the pop-up print box for Chrome, but when I hit print and send, first things first, the label is going to print out immediately. Second thing, it is going to give you the pop-up box, whether you're in Internet Explorer, well, when you're in Internet Explorer, to print your requisition. So the requisition, I would have to come and I would have to just hit print. You'll notice in Chrome that you see how it's just not a clean requisition. You can't see pieces of it. You can't see along the top here. I don't want to see print and all this. If I'm in Internet Explorer, it's going to give me a really clean looking requisition. So that's why you definitely don't want to be using Chrome. You must use print and send. I put it in red, bold, type in your manual. The print functionality will not be linked to anything with meaningful use. That is just the way MDON has it set up. So every single time, even though I know you're not sending your lab order to the lab, you always hit print and send every time. I wish you could just remove that print button from there. I've asked about that and you can't. So please make sure you're using print and send. Very important. From here, if I want to create another order for this patient, I can just hit create another. If I hit back to search, it's going to bring me back to the orders tab. And you can see my little order right here, standard lab order has been transmitted for Peppersmith. All right, now I want to walk through this process in a regular format. I'm not going to talk it through. I'm just going to show you how quickly you can create a lab order when we have everything set up on your preference list and everything is working and clicking along. So I'm just going to go click create order. Select my lab. Hit next. I'm going to select, let's just do the CBC for this one. CBC, let's say this is my code. I'm going to click add to order, validate, save the order, print and send. So you can enter multiple orders if you want to. If you need to enter in 5 lab orders and you need 5 different ICD-10 codes, you need to make sure you're doing the lab order, doing the ICD-10 code, clicking add to order, doing the next one, doing the ICD-10 code, clicking add to order. So then it associates the different codes with the lab order itself. So hopefully you guys are thinking that process is not that complicated. Once you get used to it, I feel like it's going to be a pretty user-friendly process. So I have a next section in there for miscellaneous orders, and for lab and radiology, this important section is very important. So as I mentioned, when you are in your preference list, you're going to see those miscellaneous radiology tests and the miscellaneous test. These need to be used if you cannot find your order. So the radiology orders, as I said, you always need to use this radiology test. There will be one that appears on your preference list. You're always going to select this. Let me just run through that. Let's say we got an ankle injury. I'm going to remove that one. Radiology test, ankle injury, add to order, validate order. It's going to give me these questions. For the radiology test, we definitely need to answer these questions because they have no idea what we need. If you have a test code, you could put that here. Test name, let's say I need an x-ray of left ankle. Additional information you can put in here, injured in a fall, if you want that to appear on the order. And then I would just hit the save order. And then I would hit print and send. Oh, not even sure what's caused by that. So just make sure you are using that order, the radiology order. Okay, let me refresh here. Make sure you're using that radiology order for all radiology tests, okay? That is the most important for the system for radiology. That's for meaningful use, that's for reporting. Very important that everybody's on the same page with that. I do have information on editing an existing order in there. I'm not going to walk through that in detail. It is provided step-by-step instruction. One other thing I do want to talk about with labs is reports tab and viewing lab reports. I'm just going to talk about this really quickly because it's only going to impact sites that connect to the lab. So when results come back, they're going to file in the reports tab. All the results are going to be here. If there is an A in one of these fields, that means the result is abnormal. If I want to view a result, let me see, let's do this one. I would click on it and hit open. And that's going to allow me to see the actual lab result that's come back from the lab. So this one's from LabCorp. It's going to give me all the details on this lipid panel and if there's any additional test information. So you're just going to be able to see the full result from this area. So with the reports, this will just be for Pepper Smith. If I need to search for a lab result, I can click this detailed search in the upper right-hand corner. I also have some detailed instruction in here in your manual. I could search just by patient last name. Let's say I wanted to search for a certain period of time. I could search by, every lab result that's come back in through April. If you leave this blank, it's going to default to today's date. So just so you guys are aware, you can look at the reports tab or you can create a detailed search if you're looking for a specific lab on a specific day. All right, there's information on the recurring tab, recurring orders, creating a manifest. Not going to cover that in detail. It is provided in your manual and will be talked about in further detail in lab and radiology orders training. So let's talk about point of care tests. So any medical test that takes place at the time of patient care should be documented in PANDA. This could be pregnancy tests, drug urine screens, glucose testing. I'm sure you guys got a whole long list beyond what I could think of. These need to be entered into the lab results section in PANDA. So patient records, lab results. Point of care tests will not be entered into the labs and radiology orders screen. They are going to be in this separate section, lab results. So lab results can be accessed from the internal medical encounter, so docs can access these records, and from that main area like I had showed you under health and patient records. So I'm going to start this whole topic by saying Number one, this section is currently just a work in progress. There's going to be many changes made to this section before go live or shortly after. For EMR certification, we had to add all these fields that to me make no sense at all. There's been many things with an EMR certification that didn't make any sense to me at all. So this is one area where there is too many fields and it is confusing. First and foremost, we want to change this screen on what's visible here. I've requested that the actual order of what it is, if it's a pregnancy test, that be visible. I also requested that if the result is final or pending result, that be visible, and the date of the test. I could touch base with you guys at the end and let me know if you guys think that we should have the actual result appearing here also. So this screen is going to change. When I open this up to add a new point of care test, I hope I don't scare everybody away. As you can see, there are just a lot of fields in here. I've asked them to hide all of these fields under a button where you can just add additional fields if you wanted to see that. This is what you need to worry about. Test ordered, we're just going to say it's a urine drug screen. Organization name, I'm just going to put my nurse Ann in here. I've asked for this to be changed or for us to add a field on who entered this result. Don't worry about this one. Abnormal flag, if the result is abnormal, you can set a flag. It's not required. Result status, there's a lot of statuses under here. These, again, were all required for certification. I think the most important one is going to be final results. Final results can only be changed with a corrected result. Observation value, this is going to be the actual result. So I'm just going to say this result was negative. And then I'm going to put the date of observation. That would be the date of the test, date and time of the test. And then I'm going to put the date of analysis, which we'll just say for training is the exact same time that we did it right back to back. I've also asked them to add an upload field to this so that when we do get paper lab results in, we can upload them to the system and connect them to the lab results section so that the docs can see them when they're meeting with their patient or when they're documenting in that internal medical encounter. So you'll notice there's only a few fields that are required. Obviously you want to put what test is ordered. We should make that required, but do not worry about all these other fields. I'm going to go ahead and save that information. I will keep you guys posted as we make changes to that. Hopefully it's just going to be a lot easier once we're done. All right, so let's talk about medical appointments. So after this section of the training is complete, you should know how to view and add external medical appointment information, create an internal medical encounter, and complete documentation in a medical encounter. So we are under the health menu. We're under medical appointments. Internal medical encounter is basically going to be any medical encounter that takes place with a SQL doc. External medical appointments is anything that's going to take place with a non-SQL doc. So that could be outpatient clinic, that could be dentist, that could be optometrist. I know you guys send clients for a wide variety of appointments, and those would all file in there. So I'm going to start with external medical appointments. So this section is going to contain information on outside medical information. It's definitely best practice to document after the client returns to campus what happened during that external medical appointment, and this section does have an upload field available. So I'm going to go ahead and add a new external medical appointment. You know what? I apologize. Let me get back to Ping because I'm sure he is my patient that actually has a medical appointment. Let me get back over there. There we go. He has an orthopedic appointment and he has a dentist appointment. If I want to see additional information on this external medical appointment, I would just click on this eye. It's going to show me the notes. Kind of had a cleaning and examination, one cavity found, needs to have follow-up. Use my little menu to get back to my list of client medical exams. Now I'm going to go ahead and add a new one. So exam type, there is quite a list in here, but we did add other. If there's some that you guys really need, then we can add those. Otherwise, just use that other. We'll just do pediatric. Date, when I click in the date field, it's going to document to right here, right now. If this appointment took place yesterday, let's say at 8:15. Just save that. Who's the doctor? Dr. Smith. Location, we'll just say Iowa Pediatrics. So that would just be the office that they're going to. And then you just put any notes that you have here. Physical exam performed. If there's any follow-up needed, you would document that here if he's got to go back 2 weeks or a month. I'm hoping over time we're going to be able to develop a sort of an alerts functionality that may be linked to this. There's a lot of options that we can do to improve the system, and we definitely want to do a lot of those. If I want to upload a form, I would just click on the upload file. It's going to pull to my computer. I could select an item and upload that. It does want me to name this, so we'll just say document from visit, document tag. I'll go ahead and save my external medical appointment. Now it's going to appear on the main screen. So pretty straightforward. It's really up to you guys how much information you want to document in there. If you know that your docs are going to go in and look at this, you definitely want to put more details in if it's going to help them with their practice or their interaction with the patients. So let's talk about the internal medical encounters. This by far is probably one of the most important components in the PANDA system. It is required for meaningful use that docs use this form all the time. It's under health, it's under medical appointments, and it's under internal medical encounters. So when I'm in the internal medical encounters, I can see all appointments that Ping has with docs that are at Sequel or Sequel contract docs. So when I open this up, you guys are going to see there's lots of different sections. We basically took all of the key critical documentation areas that are found in the health menu, a lot of these items on this list, and put them into one form so that the docs don't have to go in and out and back to the vital signs and back to the medical note and back to the problem list. They can find everything in one place. So the goal of this was definitely to streamline processes for the docs and to link a lot of our MU reporting to one place. So that's really the most important part about this internal medical encounter. A lot of the meaningful use reporting is linked to this. So even if a provider has to do a specific paper form for a visit, we definitely want to be telling them that they need to still set up an internal medical encounter and add that documentation to that screen. I know I told the providers this in training on Monday. If a provider does not use this form, it is very unlikely they are going to be successful for meaningful use. So just really important that they understand that you guys understand that. Obviously, I know your guys are not their boss. They're going to manage things the way they want to manage things, but just be encouraging them, reminding them, whatever we can do to try to help them, setting up the internal medical encounters ahead of time for them. Anything we can do to help them with that process I think is going to be beneficial. So one caveat, once I open up the internal medical encounter screen, I cannot change my patient. It will not let me. The system will run like it's thinking about it, but it will not allow me to change my client while I'm within that documentation screen. And we kind of created that as a safety feature so that we don't make mistakes on who's being documented on for that internal medical encounter. So let's create a new medical encounter. Let's say I know that Dr. Jones needs to see PANDA today and there's no appointment scheduled. So I'm going to go ahead and hit my green plus sign. The problem search, I've requested to have this changed to reason for visit. Let's say we're just going to do a psychiatric follow-up. The system is going to search, it's going to pull back any sort of psychiatric follow-up information. Oh, it's only got one. That makes it easy. A lot of times you're going to get a long list to choose from. Which provider is responsible for this client's visit? That's going to be the doc that the patient is seeing. What type of visit is it? Ooh, I got no options available there. That is a new situation. That's not going to let me save it because of that. I'm noticing that the system is I don't know if they're doing some changes in it or what it is, but it does seem to be running a little funny. So what is the client, when is the client scheduled for the encounter? That's going to be the date and time of the actual appointment with the doc. So it will default to right here, right now, but it can be changed easily by using the clock and the calendar. What's the primary reason for the visit? This is pulling from this problem search over here that you already completed. And then if there's any additional notes, medication management, appointment. So then I would save that encounter. I'm thinking it's not going to let me save that encounter right now though, because I got a field that's empty. I apologize. So let me go back to my internal medical encounters. I got plenty of encounters scheduled for ping. I will tell you that I have noticed that there's some areas of the system that seem to be running slow. I have talked to Willits about that. He's told me that right now we're doing a lot of the security functionality. So basically when we set up our security, it allows access to certain items in the system based on if you're a medical staff or if you're a doctor or so on and so forth. And he said that that process can slow the system down since we're first initially starting it, but that the system is just going to get faster and faster before go live because we're going to streamline those security schemes. So anything beyond that I don't understand. Sometimes he gets way too technical for me, but I did talk to him about that and he said that that would be resolved. All right, so let's complete some documentation in the internal medical encounter. So to load the encounter, you're going to see a black stethoscope icon. If you hover over it, it's going to tell you you're loading the encounter. So let me go ahead and load this one for ping. And in the medical encounter, you're going to have 3 sections. Top section is going to be the client header. Basic patient information, birth date, sex, wherever they're placed. Smoking status is even up there, medical insurance. You will note that the subscriber ID, this is likely going to be your guys' Medicaid ID or Title 19 number, so that'll be good that that's visible from the screen also. Last encounter is also visible up here and last seen by doc. Second section is going to be information about the specific encounter. You'll see that we have the primary reason as a psychiatric care reason, and then I had psychiatric intake new patient under the primary reason notes in that bottom text box so that the doc can see some additional information on why the patient is being seen. So I'm not going to go through all these items. As I scroll through, you guys are thinking, man, a lot of this stuff is familiar. I've already covered this. You guys have already learned about vital signs, non-medication allergies, medications, med allergies, medical history. There's a few components in here, though, that we haven't talked about that don't live anywhere except for inside the internal medical visit. One of those items, and I'll start with, is administered medications. So I'm going to go ahead and hit my plus sign here. So administered medications, this is going to be a medication that's administered during the medical visit. So just to be aware of that, I don't want to cause confusion with that. I may want to ask you guys at the end if this is something that is needed outside of the medical visit with regard to administering medications, or if that's always done through the MAR. I just want to make sure we're not missing anything that you guys might need. But this is specifically for during this visit with Dr. Murthy, this medication was administered, or during this visit with Dr. Vallejo, this medication was administered to the client. So we're going to search for the medication. Sorry, y'all, I just keep defaulting to albuterol. It's not really that exciting. I keep thinking about nebulizer treatments for some reason. So we'll do this. We'll select our strength. When it was administered, I'm just going to put nebulizer treatment given. And then I would just hit save. So I'm not sure how much you guys are going to utilize that. Did want to make you aware that it is available and it is found only in the internal medical encounter format. So the next section I want to talk about is medical goals. So I'm going to scroll down. We've already talked about smoking status, problems, diagnosis are in here, immunizations we've covered, procedure orders. This is a section where the lab results will file so the docs can see them. Medical notes. Let's talk about medical goals. So it's this section here. I'm going to go ahead and hit my green plus sign to add a new medical goal. So this section basically allows us to be able to create and establish health goals with our patients. This may be a section you guys use frequently, maybe a section you guys don't use frequently. Definitely up to you. I'm going to do smoking cessation since that one is pretty common. Let's say we provided smoking cessation counseling, encouraged to quit smoking provided education. Let's set a goal date of 5/1. Wish it was that easy for people that are smokers, but it's really. Start date, when are you going to start working on this goal, and the status, you're always going to want to make that active if that goal is active. You could add, medication management type goals. You could add goals about exercise. There's a lot of different options available in that screen. I did request that they add a text field for the tracking of the progress of the goal, because I think that's probably really important. So that will be added also. The other section I want to talk about in here that is probably looking a little unfamiliar is the exam section. So this was required for EMR certification. I anticipate the docs are going to be doing most of the documentation in here, but I did want to point out a couple things. Just so we're clear, instructions, decision aids, this is basically patient instructions. If you've given a patient specific instruction on something, you'd want to document it here. Patient education provided. I have this highlighted in bright red bold print in your manual. This is the only way that we can prove that we have provided patient education during this visit. This is where the documentation takes place. So if you guys provide patient education, which I know we talked about in medical training 1, but I'm going to show you guys again. It's under health, patient management, education resources. That's where all those resources are going to live that you guys are sending me. But the documentation has to be noted in the encounter. So if you provide patient education, change that to yes, because you can provide that and include, be included in our MU reporting. If the doc provides patient education, they should select this and they should change this to yes. We have to do that 10% of the time, 10% of visits. So please be aware of that. That's a really important piece in this exam functionality. The depression screening performed, this is linked to one of SQL's clinical quality measures, which we're going to talk about in just a minute. If you complete a depression screening, please set this field to yes. Right now it is defaulting to yes, but it will not be at Go Live. Make sure it's set to yes. You can use one of the assessments that's already in the system, because we have created that PHQ-9 depression screening tool, or you can use any depression screening tool that you guys have that you commonly use, and it will satisfy this reporting requirement. For the clinical quality measures, they don't have a specific threshold. It's not 10% of the time or 20% of the time. They just want us reporting on that. If we report on it 1% of the time, great. If we report on it 0, it's still okay for 2016. So these two pieces are related to MU, these bottom two pieces. Make sure you're checking this and touching base with the doc if you're involved in any of their visits, because we definitely want to encourage them to get that 10%. All right, let's get out of this internal medical encounter and let's start talking about the health information exchange. Page 79 in your manual. We're getting really close to being done, you guys. I just got a couple more topics. So this meaningful use measure states that when a provider transitions or refers their patient to another setting of care or to another provider of care, the doctor should use PANDA to create a summary of care record and transmit that summary electronically 10% of the time. Wow, that's a mouthful. Okay, so basically, a summary of care record could be created when, and Marianne helped me come up with this list, a client transfers from one SQL program to another, a client's healthcare transfers from one SQL doctor to another SQL doctor, so that may be less frequent.
Actually,
go ahead.
That one last night I found out we can avoid. So it will only occur when you make a referral to an external provider that is, maybe the pediatrics office in Iowa or some situation like that, or if you discharge the student from your care. So basically, if they're discharged from the program and you know who their next provider is going to be, then that would count too. But if you transfer them from Dr. Cooperman to Dr. Holland, all within Mingus, then you do not have to produce a summary of care record. But if you transfer them from Mingus to Lakeside, Michigan, so if they discharge Mingus and go to Lakeside, even though you're both on PANDA, you would still have to do the summary of care record. Let me know if that made sense or not.
That made sense to me. I know we talked in the provider training that we're going to create kind of care teams for each individual site so that there's not the issue with having to transfer care within the Mingus docs or within the Woodward docs. So scratch that one out on your training manual. This one is definitely going to have to do with external or transferring to another program. Thanks, Marianne, for clarifying that.
Yep, if there's any questions after the call, I can answer them. That was new information last night.
We love meaningful use. There's always new information. Okay, so what the heck is a summary of care record? Some of you guys are probably thinking. So it is a copy of key information from a patient record. It provides, and I put this in your manual, provides authorized care professionals with faster, secure access to essential information about the patient and their healthcare needs. So overall, it's supposed to improve safety and quality of patient care, but it basically what PANDA does is it creates a report that includes the most critical health information for the patient, problem lists, diagnosis, medications, allergies, medical alerts, just like the most critical items, and creates a report that can be sent to an external provider, to a referred provider, to an orthopedic doctor, whatever referral you guys are doing, or transfer of care at discharge. So every certified EHR must be able to create and send and receive SCRs. So anybody that you guys work with, any clinics, referral docs, anybody that uses a certified EMR, they have to have the capability of doing this. So I put an example in there of the direct messaging address. It's kind of like an email address, but it basically allows PANDA to send the summary of care record electronically to another EMR. That's the functionality. It's communication between EMRs that is required for certification. So the recommendation here is if your site refers a client to specific clinics or doctors regularly, I highly recommend before go live, just call them and say, hey, do you guys have a direct messaging address? Are you guys using a certified EMR? Hopefully it's going to be a couple minute phone call. And if you can get a few of those addresses and create some sort of directory at your site to have that after go live, you guys are going to be completely successful with this. I think that majority of docs are using certified technology now. It's really, there's such a push with it that I feel like less and less we're running into doctors that are using non-certified EHRs. All right, transmission is basically releasing medical records. Marianne is working on the release of information stuff needing to be signed prior to transmitting the summary of care record. We're going to work this into the current patient consent stuff. There's a consent with the patient portal. There's consents with this transmission of summary of care record because you're releasing records to an outside provider. So there is work going on behind the scenes for that release of information, make sure that we're in compliance with HIPAA and all those things. All right, so in PANDA, the creation of a SCR will be available in 2 locations. In the discharge screen, it can be found by going to admissions and discharge, and in referral orders, it can be found under the orders to referral orders menu. So summary care development is still in process. As Marianne said, she's just discovering information even as of last night, but we have been working with a company called XPO. They're kind of meaningful use experts is pretty much all they do. I feel very bad for them because that would be a miserable job, but we've been working with them very closely to make sure that we create this correctly in PANDA. It will be ready for May 1, but right now it's definitely under construction. I'm going to show it to you in admissions, in discharge. I do have a screenshot in your training manual. This stuff has not been added to the referral screen. It's going to hide under a button there, but it will be the exact same format. So basically what we're going to do, and I've asked them to put it here. If you guys can see where I'm putting my mouse kind of over here from the send, there's going to be a button that says create summary of care record or create SCR. We need to be entering the date of the release, when we're sending that SCR, who it's being released by. So this is going to be a drop down of the medical staff that are at your site. Provider name, who's the doctor that's releasing these results. Provider address, so this is going to be Woodward, Mingus, phone number, any comments that you want to send to that receiving provider. And then this is going to be that recipient's direct care address, which, like I put in the manual, is that b.well@direct.aclinic.org. It's similar to that. Every single provider is actually going to have their own direct messaging address. And I know that we're working through that process right now in their certification. So please don't be super overwhelmed by this. I know it's an additional step. It's 10% of the time. So just start thinking about with referrals, even if you have, you know, 2 providers that you refer to frequently that use a certified EMR, make it a practice that every time we refer to them, we create this SCR. Yeah, I know we're going to run into docs we refer to that don't have this functionality. They just don't have it, and that's okay. It doesn't have to be done 100% of the time. It's just 10% of the time that we need to be aware of this. This MU objective, though, by far was probably the most confusing to me. So if we have questions, we can definitely talk about this in more detail at the end of training. All right, clinical quality measures. This is a MU reporting requirement. So basically, these are tools that the Center of Medicaid and Medicare have kind of come up with based on best practice, medical practice recommendations, so on and so forth. So they really feel that's going to help ensure that our healthcare system is delivering efficient, safe, effective, patient-centered, equitable, and timely care, which that's quite a mouthful. But that's the purpose of the CQMs. So basically what happened is they provide this list of CQMs. It was like maybe 60 or 70 CQMs. And we had to pick 9. We're required to have 9 in PANDA for certification and for meaningful use. The list we're able to choose from was not really behavioral health friendly. So we did our best to try to select the ones that are most applicable to the most SQL programs. There's going to be some on this list that you're going to be like, that is not, we don't do anything with that. That is not even something we focus on. That's okay. We can report 0 for the CQMs. That may change in 2017, but for right now, the purpose is just showing them that we're capable of reporting and that we have the functionality available. So I'm going to run through these fairly quickly, just because they are, you know, there's no thresholds, there's no specific requirements. The first 6 on this list require specific documentation in PANDA. The last 3 on the list are going to be reported based on data entry or encounters scheduled. So there's nothing to actually document or worry about. So number 1, documentation of current medications in the medical record. In PANDA, if you review and document all of a patient's current medications, click on the Medications Reviewed button. I apologize because I did not talk about that when we were in that screen, so let me launch that quick. So for this measure, they're saying that it's 18 and older. Well, obviously we know we have a lot of clients that are less than age 18, but I think it's still best practice to select that if we reviewed the patient's medications. Only the ones that are 18 and older are actually going to be reported to meaningful use. That is right here, medications reviewed. So I would just click on the little no. I'm going to change it to yes. The only medical reason exception that they talked about is if, well, let me show you. If you want more information on this measure, click on this little blue eye icon. So when the patient is in an urgent or emergent medical situation where time is of the essence and to delay treatment would jeopardize a patient's health status. I don't anticipate that happening very often, but there is specifics here on the medical reason exception. So I definitely think if you guys are reviewing the patient's medication during medical visits or the docs are doing it, we just want them selecting that yes, and that's all it is, just changing that from no to yes. Number 2, preventative care and screening. This is screening for clinical depression and follow-up plan. So they recommend that any patient aged 12 years or older be screened for clinical depression on the date of the encounter. I think this is, my personal opinion is that this is a lot to think about for every patient that's over the age of 12, but this is the recommendation. So if any depression screening is performed, we just need to document that in that exam section that we talked about in the internal encounter form in here. Depression screening performed, select yes. There are some different options a patient could refuse, be medical reason, and again, you're going to see this little eye icon. It's going to give you additional details on what those items would be. This can be any depression screening, so that's important to note. It could be one that you guys have on paper, the client fills out, or it could be one that's in PANDA. All right, the next one, closing the referral loop, receipt of a specialist report. So basically for this, what they're asking is, did we receive a report from the referring doctor or the referred doctor? I'm thinking that a lot of the time we probably do. If I received a report when a client came back, all I need to do is go into my referral order, and I can do this from the health menu or I can do it from an internal medical encounter. I can edit my order, and you'll see that this field is now here. This field was not here when I created the order, but once I save it, this populates, so then I can just say, yes, I did receive a report back after that patient had that appointment, and then I just hit save. Really straightforward documentation on that one. Number 4, preventative care and screening, tobacco use, and cessation intervention. So we talked about this in the smoking status section. They're recommending that we document a smoking status 2 times within a 24-month period using the smoking status log that lives both in here and in the health menu. When you're doing a smoking status log, you'll see there's a received cessation intervention. That's what triggers the report for the CQM. So if you are identifying this person as a smoker, we need to document received cessation intervention. I did find out with the smoking status, we are able to add any form of tobacco, but this is not for THC or marijuana use. That should be tracked under substance abuse. I did not know that, but I did clarify that yesterday. They did say that we could add smokeless tobacco and vaping, which Dr. Cooperman had requested, so we can get those added. All right, 5 and 6 are kind of joined together. If major depressive disorder is added to either a child or an adult's problem list, they recommend that we complete a suicide risk assessment. This applies both to adults and children, and SEEK will report on this CQM once the MDD is added and the provider or nurse completes the PANDA suicide risk assessment from the medical assessment section. So this one's a little bit different than the other depression screening. This one we actually need to complete the medical assessment inside PANDA. Is that the suicide scale? I know that Marianne, you were working on, yes. I don't even know how to say that, suicidality scale. So if we complete that form, then it will send a report. This one you cannot use any sort of outside documentation. It has to be within PANDA. So the next 3 are automatically coded for reporting and don't require any specific documentation. Basically, if a patient has a form of persistent asthma that's added to the problem list and asthma medication is prescribed, we'll report that CQM. The ADHD one, basically if a client is newly prescribed, and this is only kids age 6 to 12, newly prescribed attention deficit hyperactivity disorder medications, they need to have a follow-up appointment within 30 days. That's the recommendation. So we report then, and then a second report could be made if the child remains on the medication for 210 days and has 2 follow-up visits with the provider in 270 days. That one is quite a mouthful. Last but not least, the hemoglobin A1C test. So this is for patients age 5 to 17, excuse me. So basically, when a form of diabetes is added to the patient's problem list and a hemoglobin A1C result is entered into PANDA, either through the lab and diagnostic orders automatically, electronically, or through the lab results section that we talked about, that will trigger a report for the CQM. I know some of those are really complex. Don't spend too much time worrying about those. You know, if we can note a few things in the internal medical encounter with medications being reviewed or depression screening performed, I think we're going to be in a good position. Okay, last and maybe least, the clinical decision support MU objective. This is on page 86. So I just kind of wanted to make sure everybody kind of understood CDS. This is required for PANDA to have. You guys don't have to do anything for this. Make a note of that. Basically, we have to have these enabled in the system. They had to be linked to certain things. They had to be linked to problem lists. They had to be linked to allergies. They had to be linked to medications. There was a lot of different things we had to pick from. So with regards to the CDS, you will receive an alert. And you can see I got a couple alerts going on up here. I don't know which alerts I got. I got a transmission error, pending prescription, and then I do have a CDS alert. So I'm going to go ahead and click on the CDS alert. You'll notice that this is for Ping Panda. His name is going to be right here. So what is a CDS alert for Ping Panda? I'm going to click on it. Here's the recommendation. This patient's BMI is above normal. Please provide nutrition and or physical activity counseling for this patient. That's it. It's not telling you you have to do anything. It's not forcing you to do anything. It's not interrupting your workflow. We definitely wanted the alerts to be really subtle but available. So if you choose, you can provide nutrition and physical activity counseling to Ping because he's noted as having a BMI that's above normal. If If you want to view evidence as to why CMS chose this, here is some really detailed, if you guys need some good reading at bedtime, here is some evidence and rationale as to why the CDS is in PANDA. But I do feel like they're really straightforward. I'm not going to go through all those CDS, you guys, because I know we're getting tight on time, but there is 6 of them. They're listed in your manual, kind of laid them out in detail as to why you will get them or what will trigger them, but they will always appear here. I got the penicillins allergy one is here too, screening for clinical depression, that one's popped up. So I do have a lot of alerts here going on, but there's no reason to focus on those alerts. They're just available. I just want you guys to be clear as when you're looking at your system wondering, what's that red number, that number next to that bell? That's what those are for. All right, you guys have all been to Medical 1, I think. Yeah, you had to have been because I've already done it twice and hopefully I'm not doing it again. So you guys know about the PANDA Go Live support. You guys know about the suggestion box that is up on the portal now. So if you guys have suggestions, please run through there. Prior to Go Live, if you guys have stuff that you really need, just email me. I definitely, after Go Live, probably will want you guys to start using that suggestion box because there's going to be a lot going on. But if you guys need to get in contact with me, you guys always know where to find me. We have the sandbox up and running. If you guys are running into issues or anything or something's not working, just let me know. We've separated the environments now, so we have the sandbox and we have the pipeline, which is connected to the live environment. So there is some things that you're gonna find in the pipeline that are not in the sandbox because we do not want to build things twice now. The sandbox is what it is. We're doing some upgrades on the pipeline and making sure we're getting that ready for Go Live, but they are 2 separate environments. So even with those education resources, I'm going to add those to the pipeline. I'm not going to add those to the sandbox. So please don't think we aren't working on some of the things you guys have requested. They're just not available in the sandbox like they're going to be in the live environment. Please make sure you complete your quiz. This is Medical Training 2, so make sure you complete that quiz and not any of the others. And with that, I will open it up to questions. What you guys got?